Thank you, Lieutenant Governor. Thank you, Governor. Good afternoon, everyone. I'm glad being here on behalf of our colleagues at the Rhode Island Department of Health to share with you an important COVID-19 update so that we stay up to speed on what has been occurring. So we have seen an uptick in cases over the last several weeks. Our percent positivity was 3.2% last week, which is roughly double what it was only just a month ago. And while we never focus too closely on one day's numbers in terms of understanding an overall trend, it's helpful to make you aware that our percent positivity today is greater than 5%. Increases like these are not surprising. They remind us that the Delta strain of COVID-19 continues to require active approaches to prevent transmission. When you think about it, it's a good news story. We have the tools that are in place to help protect us as we're going into our colder months. But similar to what we're seeing in other states, particularly in this region, also going into colder months, we know that it's time to activate those tools. As we move back indoors, as winter sports start to happen, we need to double down on those measures, those mitigation measures that we know work. If you think about it, you know what they are. It's getting vaccinated. It's getting tested regularly. It's wearing a mask, particularly indoors. It's keeping the distance, particularly if you're in a crowded space. All of these are tools that we have to help stop transmission of an extremely contagious version of coronavirus that we've been dealing with for several months, the Delta strain. We see what happens with the Delta strain when we let our guards down. So our message today is keep your guards up. Don't let them down. Use the tools that Rhode Island has in place for you, leading the nation in helping to keep you and your families safe. Doubling down on what we know works means making sure our masks stay on. We know in the warmer months when the cases were low and more people were outside, it made sense. But it's getting colder, more people are going indoors. Now's the time. Get your masks ready, your high-grade quality masks, and make sure that you're wearing them. Make sure your family members are wearing them, particularly indoors. It means practicing social distancing whenever possible. If you go somewhere and it's more crowded than it needs to be, there are more people that aren't wearing masks, you're indoors, the ventilation isn't as good, think twice about it. We know that the tools we have are effective. Make sure you're vaccinated. I'm going to talk further about the boosters that are available for you. Our 5 to 11-year-olds, we can get further vaccinated. Access the testing programs that we have. Encourage your schools to use the testing programs that are in place. Let's use all the tools that we have, the nation recognizes us for. We have them here for all of you. So we want to make sure together that we're taking advantage of that. For getting vaccinated, parents and families know that vaccine is available for children 5 years of age and older. The vaccine is safe. The Pfizer vaccine has been given to billions of people worldwide. Those are perfect ways to demonstrate the safety of the vaccine. I also want to say again that booster doses are available to people at higher risk. So following the EUA that says that, with all of us moving indoors and with higher levels of transmission, as we've talked about here in Rhode Island, most people 18 to 64 and older find themselves at some higher risk of exposure. That means you can get a booster dose. We want to strongly encourage that. Certainly, if you're 65 or older and it's been 6 months, get your booster dose today. Do not hesitate. If you're 18 and older and have an underlying medical condition or live or work in a high-risk setting, get your booster dose today. But as I've just said, given our higher transmission, 18 and over, it fits within the EUA to say you are likely at higher risk of exposure because of the transmission that's here. Go and get your booster dose. Encourage your loved ones. With the holidays coming up, hands down, the best way to celebrate safely, which is what we want everyone to be able to do, is to get fully vaccinated against COVID-19. And then in addition to that, apply the mitigation steps that we know work. It's important for you to hear, vaccine is first and foremost, and it doesn't stop there. It's vaccine, wearing your mask, getting tested regularly, socially distancing. All of those coming together is what leads to us all enjoying our holidays safely. If you are eligible to be vaccinated, but sadly choose not to be vaccinated, it's important to know that you are creating a higher risk situation for the people you love around you and who you may be seeing during the Thanksgiving time. There's no way around that interpretation. So, show your love for those that you care for. Take care of yourself. Get yourself vaccinated. Get the children and family members around you vaccinated. Let's review those additional measures in addition to getting vaccinated that people can take to make the holidays as safe as possible. We want you to enjoy them because we need it, but we want you to do it safely because we can. Consider getting tested before your Thanksgiving celebration. Testing here in Rhode Island is fast, our systems are robust, and it's easy. The turnaround time is available quickly for you. Take advantage of it. Consider creating more ventilation at your Thanksgiving gathering. Perhaps cracking the windows if the weather allows. Just thinking about those types of possibilities can make a difference. Importantly, every single time, absolutely stay home if you are feeling any symptoms or if someone you live with is having symptoms. And if you're the host in that situation, please do not host several family members or loved ones coming over knowing that you have symptoms. If you will be traveling, remember, masks are required on planes, buses, trains, and other forms of public transportation. Wearing a mask is always a good idea. I've said from the beginning, as an infectious disease physician, masks work to prevent respiratory droplet spread of COVID-19. It's another layer that we have with vaccination. Please do it indoors, wherever you're comfortable. Encourage others around you. And certainly, if you're going in a public, crowded, or indoor setting, like the grocery store, wear your masks in those situations. Another thing you want to do during this time is get your flu shot. There's more than one respiratory virus that is out there. But importantly, for them, we have the tools that work. We're seeing flu activity earlier than usual this year. The flu numbers we're seeing now in Rhode Island, we sometimes don't see until January. Similar to COVID, the flu can be a serious virus that spreads when we're around other people. So get your flu shot today. If you're at high risk for flu complications, there's also an antiviral medication available. Call your healthcare provider to learn more. And just the same way masks work with COVID, masks are helpful there as well. So you're able to get multiple advantages from implementing the basic measures that we're talking about and that all of you know. The last recommendation I'll leave with you today about the holidays is to communicate. Keep communicating. Proactively have conversations in advance with the people in your family about how to be cautious during COVID-19 and what to expect. If you're hosting, set it up so that you encourage everyone that comes to be vaccinated. Make it a norm that if it's at a place where there are many people involved, that a mask is worn. Set the tables up and the seating arrangements up so that there can be social distancing. There are small changes that can be made that make a huge difference, particularly for those that you love. At this time last year, we were giving people very specific directions about what the holidays needed to look like. They were much more significant than what we are talking about now. So this year, people, you have more discretion, but don't forget the basic mitigation measures that we're talking about. If you're hosting Thanksgiving, you might want to keep it smaller and only have people who are vaccinated if they're eligible. And you might have specific preferences about mask wearing, as I've shared. You can eliminate potential stress or misunderstandings on Thanksgiving Day by reaching out now to the people you will be spending the holiday with to make sure everyone is on the same page. Use it as an opportunity to encourage someone who wondered whether or not they should get vaccinated and wonders about getting tested or wearing a mask. Thanksgiving is a wonderful holiday to gather with friends and family. And as I've said, we need it. Reach out to one another, encouraging each other, reflect on the blessings in our lives, similar to what Lieutenant Governor shared. We want everyone to be able to do that this year with making sure that you have the proper tools and the ability to be thoughtful and gather as safely as possible. You all have it. Rhode Island is ready. We can respond to what we're seeing. We're not surprised. We want to make sure you take into your own hands the ability for us to get through this safely together.